Did you know that the first heart transplant in 1967 possibly involved a murder? Did you know that the surgeon who did it became instantly more famous than the Beatles, at least according to his ex-wife, because after he became famous, he divorced her and had many affairs. Did you also know that because of this first heart transplant and questions around it, it inevitably led to the Harvard criteria of brain death? Well, all these statements are true, and I'd like to tell you about them. My name is Gregory Pence. I'm a bioethicist at the University of Alabama in Birmingham. This is my personal YouTube channel. I'm not speaking for the university. And this is called Great Stories in Bioethics. And this is the first one. It's important to understand that in 1967, in America and in South Africa, there's only one way to be dead. And that's called the whole body standard of death, which means basically that your heart and your lungs have to completely stop on their own for a good amount of time. There's no other way to be legally dead. If you're not dead, you're legally a person. So let's talk a little bit about Christiaan Barnard. He grew up poor in South Africa. He went to medical school there, and he was very ambitious. Had a little bit of a chip on his shoulder about the way South African medicine was perceived, which, as we'll see, played a role in his doing the first heart transplant. He eventually got a fellowship to study transplant medicine at the University of Minnesota under a very famous surgeon named Owen Wagenstein. And he was so poor there that he actually had to work and moonlight as a janitor to pay his expenses. Well, when he finished, Wagenstein sent him back to South Africa with a heart-lung bypass machine, which was very useful in doing heart surgery. The heart stopped for a while and the patient still had to breathe and get oxygenated blood. No one expected, of course, Barnard to use that to do a heart transplant. But something very important happened in November of 1967. A surgeon, an American surgeon named Norman Shumway at Stanford, announced that he was seeking a donor to do the first heart transplant. Now, secretly, Christiaan Barnard, with his brother Marius, who was also a surgeon, had been experimenting on dogs doing a heart transplant. And this galvanized Barnard to seek a possible donor and a possible recipient. And on December 2nd, 1967, a young woman named Denise Darvall was crossing the street to a bakery with her mother, and a speeding car, maybe a drunk driver, hit her and her mother. Her mother was killed instantly, and Denise's head was pretty much destroyed, but her heart was still strong as she was taken to the emergency room. Barnard also had in the hospital an aging boxer named Louis Washkansky, who was a fighter in more ways than one, but he was dying. When Barnard took out his old heart, it was like a kind of a rotten zucchini. It was barely quivering. So Christiaan Barnard asked Denise Darvall's father, Edward, your daughter is hopeless, but she might be able to help Louis. Could we possibly transplant her heart? And Edward said, if you can help this other man, go ahead. So in a long operation, Christiaan Barnard did, in fact, transplant Denise Darvall's heart into Louis Washkansky, and 36 hours later, he woke up and he ate a poached egg. For the next 18 days, he had a lot of problems. You see, the problem at the time, and the reason no one expected Barnard to do a heart transplant, is that the immune system would naturally reject any kind of foreign body. There were immunosuppressive drugs at the time, but if you gave them, you also opened the patient to all kinds of germs and infections. And it was very hard to balance these two things. So Washi, as he was known, went up and down over the next 18 days. He finally, Barnard guessed wrong. He kept giving him immunosuppressive drugs, and it was actually an infection that killed him. Nevertheless, Barnard had done something never done before. He had transplanted a heart from one human being into another who had lived. And about a month later, he actually did a second one to a dentist named Philip Layberg, who lived much longer. By the way, it was also important that Denise Darbolle was white. In South Africa of the time, and politically around the world, Barnard thought it was impossible that the donor be black and the recipient be white. Overnight, Christiaan Barnard was amazingly famous. He was on the cover of Time magazine. He went to meet the President of the United States. He actually had heart patients waiting that he kind of abandoned and left to the care of his brother Marius. And he also immediately divorced his wife Loki. He married a 19-year-old model. He had an affair with Gina Lollobrigida. In his two memoirs, he brags almost as much about all the women he bedded as he does about heart transplants. It kind of all went to his head. Meanwhile, all the surgeons around the world were kind of jealous of how famous this unknown South African surgeon had become. And in Richmond, Virginia, there was a surgeon named Richard Lauer who had been trying to do a heart transplant, and he immediately found a donor, a black man named Bruce Tucker, and transplanted his heart into a white man. But it didn't work. Lauer did not get permission of Tucker's family to press charges. In a fairly sensational trial, Lauer barely got off. It was an all-white jury in 1968. However, in both Barnard's case and in the Richmond case, surgeons around the world were suspicious. How did Denise Darbolle's heart stop? It had to stop for her to be legally dead, and therefore she would have been a cadaver. But if her heart stopped, something clinical or medical stopped it, it would have been damaged and it wouldn't have been suitable for a transplant. Exactly the same problem with Bruce Tucker in Richmond. How did his heart stop? So, and we'll find an answer to that later. But in the meantime, surgeons wanted to do transplants. They needed a way to be sure that they could take the organ from the donor, so to speak. So it's no surprise that in August of that year, an ad hoc committee at Harvard came up with what's now called the Harvard criteria of brain death. And in this criteria, they do an electroencephalogram of your brain, an EEG, and it has to be flat for 24 hours. They stick ice in your ears, they give you pinpricks, all kinds of things to make sure that you're basically dead. And if you meet the Harvard criteria, you are a cadaver. No one who's ever met the Harvard criteria has ever come back to life. So what happens next? We now have this Harvard criteria of brain death, and surgeons all over the world start doing heart transplants. It's not a good thing, believe it or not. As Francis Moore said, and he was the chair of surgery at Harvard, it was the year that surgery went nuts. There were 104 heart transplants in 1968, and the results were just miserable. I think 54 died within the first 2 weeks. 19 or 20 died on the operating table. Barely anybody lived for 2 years, and if they did, they were almost comatose, or they were psychotic, they were constantly had overloaded infections or immunosuppressive drugs. The reporters were caught up in the symbolism and the sensationalism of all this, and they missed the clinical misery. And so at the end of 1968, the Montreal Heart Institute said enough is enough, we're doing a moratorium. Harvard quickly followed, as did Pittsburgh. My own institution, UAB, the great surgeon John Kirkland, wouldn't even start because he said, quote, the science isn't there. Again, let's go back to the question of how Denise Darbolle's heart stopped. Well, Christiaan Barnard lived a while. He, like I said, he bragged about all his affairs. And at age 60, he actually married another 19-year-old who bore him 2 children before leaving him. But at the end of his life, he really kind of had a bad reputation. He made some endorsements of facial creams that, just saying false things about them. He died alone in a swimming pool at Cyprus with an asthma attack. After that, his brother Marius, who may have been a little resentful at all the publicity his brother had gotten, and also being stuck taking care of cardiac patients that Christiaan had abandoned, he revealed, that is, Marius revealed, that Barnard had actually injected potassium into Denise Darvall's heart to stop it. So, under South African law, Barnard had intentionally taken a patient who was legally a person and caused her to become a cadaver. And technically, that is murder. In 2017, I was lucky enough to be invited to the University of Cape Town to give the anniversary lecture on the ethics of the first heart transplant. As I took a cab from the airport to downtown Cape Town, I knew I might be in a little trouble because I saw a huge skyscraper, which was the Christiaan Barnard Hospital. Christiaan Barnard is the national hero of South African medicine. And I was about to tell a story that not everybody knew in South Africa. So I gave the story, and I told the story of how Denise had actually, her heart had been stopped by this potassium injection. In the audience was the chair of surgery at the University of Cape Town at Good Shore Hospital, and he was not happy. Nevertheless, everything I said was true. And afterwards, by an amazing kind of serendipity, an old man who was a physician came up to me and said, "You know, Dr. Pence, I was actually in the room, and what you said is true. Barnard did inject potassium into her heart." He also added that the head nurse had to keep all the young women away from Barnard because he was such a legend. It is a shame that Christiaan Barnard became so famous. Meanwhile, back in America, Norman Shumway did in fact do the first American heart transplant. He had the permission of his ethics committee. He wanted to make sure that everybody benefited as much as possible. Unfortunately, no one knows his name. If you're inside surgery, you know that he's the father of heart surgery, especially transplant surgery in America and in the world. He trained many heart surgeons. So ethically, it's unfortunate that we always remember the surgeon or the doctor who went first without knowing the ethical context of how they went first. And we really need to remember that. So I hope you enjoyed my first story. If you did, please give me a thumbs up and even better, subscribe.